Hello everyone, I am Dr. Deepak Thakur, Senior Consultant Pediatric and Fetal Cardiology. Today's video is about congenital heart defects. What are these congenital heart defects? This is a very important topic related to your child's health. So congenital heart defects are the defects which are present in the child right from birth. There are defects in the formation of the heart. The defect can be in any form. It can be either a hole in the heart, a problem with the valve in the heart of your child, or it can be a blockage in any of the vessels which supplies the blood to the body or to the lungs. So there are various type of congenital heart defects, and the severity of these heart defects varies. Right from birth, the child can present with the features of this heart defect, or sometimes these heart defects are missed because they are not that critical, and later on in life we find out that this child is having certain type of congenital heart defects. So what are the symptoms which you have to keep in mind, or you have to look out in your child if you feel that your child is a case of congenital heart defect? So if you talk about the symptoms which the child have, if the child is having congenital heart defects, can be varied. The child can present right at birth. We will talk about immediately after birth what all symptoms the child can have, which will predict that this newborn baby is having a congenital heart defect. So the baby can have difficulty in breathing. The baby might need assisted oxygen support or an hospitalization due to inability to maintain the saturation or inability to maintain the normal breathing pattern. Or the child can be blue right from the birth. That is the blue baby syndrome, as we always hear from the other people. So these are certain congenital heart defect problems which you can find in your baby right at birth. Sometimes the baby get discharged from the hospital, and later on, as the baby lands up in the house and stays with the mother, the other difficulties which we see in the home care of the baby is that the baby might not be taking feeds normally. The baby might be taking feed and will not be taking feed for a continuous 10 to 20 minutes duration. The child might be taking feed for a very short duration, then taking deep breaths, then again taking feed, then taking deep breaths. So this is known as suck, rest, suck cycle. So this happens because the baby has got certain type of heart defect, maybe a hole in the heart, a large hole in the heart, or maybe the leakage in the valve which is causing heart failure to the baby. So the only exercise for a newborn baby is taking feed, that is sucking on the mother's breast. That is the only exercise. So during that exercise, it's a kind of exertion for the baby. So as the child get exerted while taking the feed, because it's an exercise, the heart starts failing and the child feel breathless. Then the baby will stop and take the feed again. Another thing what the newborn babies can show after discharge, if the baby goes home, is if the sleeping baby breathing is very fast, or you can see some thumping sensation on the chest of the baby while you are cleaning the baby or giving bath to the baby, it means that this baby might also be having some type of heart defect, and the child need to get evaluated in detail from an expert like a pediatric cardiologist or a cardiologist nearby you. So these are certain symptoms which we have to keep in mind for a newborn baby, especially if the baby immediately after birth is turning blue. So the baby can turn blue right in a normal state also, while resting also. The nails might be blue or the lips might be blue. So this is known as cyanosis in the medical terminology. Or the baby might turn blue on excessive crying. Like the baby is crying too much, and only on crying the baby is turning blue. That is also a red alert for you. You should meet your cardiologist at that time. So these are certain things you have to keep in mind for a newborn baby. Now coming to the older babies, the babies who have grown up. So as the baby grow up, sometimes these congenital heart defects are missed because this might not be that critical heart defects. These might be simple heart defects, but yes, of course, as the baby is growing, they are going to have an impact on the growth of the baby. So we are talking now about the babies past 1 month till 2 years of age. We call it as a toddler age group. So what all things you have to look for in your baby when the baby is in the toddler age group? So this is the age group when the baby is developing a lot of milestones. The baby will start moving, will start taking home-based meal, home-based food. The baby will be crawling, running, standing, sitting, walking in a walker. So all these things the baby develop during this age group. So the most important symptoms to look out in your toddler age group when the baby has grown up, if you suspect any heart defect in the baby, is again the child will be having recurrent episodes of cough and cold. Repeated chest infection is one red alert sign that the child might be having a congenital heart defect. Another thing is sometimes the babies start turning blue after 1 to 2 months of age. So once the baby crosses this age group, you are finding that the baby is turning blue at a later age, that is after 2 to 3 months of age. That is also a red alert for you that the child might be having a congenital heart defect. Another important feature which you have to look for is that the baby is gaining adequate weight. What I mean by adequate weight is that from your end, you are giving the best possible food. Your child is taking the food intake is very well. You are giving nutritious food to your child, or you are weaning the child very well. You're feeding the baby very well. But even then, despite all the efforts, the child is not gaining adequate weight. So that becomes an indication that your baby's heart should be evaluated. So these are certain features which we look for in the toddler age group. Then coming to the big children, the children past 2 years of age, 2 to 10 years, or till teenage also. So what are the symptoms you have to look for in these grown-up babies? If you suspect any congenital heart defect, it might be missed during the early childhood because the child might not be having that much symptom, or heart has not gone into that much stress. But as the body proportion increases, if the child is having any heart defect, the load on the heart will keep on increasing because the functionality of the child is increasing. Now the child will be able to walk as the child grows. Child will be playing outside the house with his peer group, will be running around, will be doing cycling, climbing the stairs, jumping from various places. So the child activity has increased, the functionality has increased. So as the functionality increases, the load on the heart will increase. So any simple heart defect or kind of a heart defect which is tolerated well by the heart till this age will start showing the symptoms. What all symptoms you have to look for in this children also? Again, basic symptoms will be same, that they will also be having episodes of recurrent cough and cold, and they will be having breathlessness or developing pneumonia once or twice in a year. Another thing is easy fatigability. These grown-up kids get easily fatigued. What I mean to say by that is that the child is not able to perform as at par the age group, the other children who might not be having the heart defect. The child will not be able to outperform them or perform as far in the physical activities compared to a healthy child. So these are the things you have to look for. Rather than these, the other things which you have to look for is any abnormality of the chest, any thumping sensation on the chest of the child, any persistent headache, any persistent leg pain, chest pain. These are the other things you have to look for in a grown-up child with the heart defect. If you are suspecting a heart defect, we should get the children evaluated by a local pediatrician or a pediatric cardiologist who can help us in detecting these kind of heart defects. My suggestion as a pediatric cardiologist is always there that you keep all the symptoms in your mind, and if you feel your child is having any of these symptoms, do get the child evaluated, because children don't speak about themselves. They will only speak about when they become very critical. Then only you will come to know that the child is having a critical heart condition. But if you keep all the symptoms in your mind, you can get your child evaluated properly and detect all these heart defects right on time and get them cured so the child can have a fruitful life. Thank you so much for watching this video.